Alamobana, ang, abit eneha, maraming, tao, lalo na, health conscious, fitness enthusiasts, Pagkatapos, Kumain, ng lunch, or dinner, mag-exercise god, mag-jogging, mag-gym, mag-workout, kazi inisip niala better to burn the calories immediately, prevent fat storage, boost metabolism, pero, ang hindi nila alam, ang practice na yan sobrang delikado, life-threatening pa, kasi may nangyayaring biological process saya. Katawan MOU pagkatapos, kumain na hindi MOU, dapat interrupt with intense physical activity. At pag nag-exercise skier immediately after eating, multiple dangerous things happen. Una, nag-compete ang blood flow mo between digestive system at muscles, resulting in insufficient blood for both. Pangalawa, ang heart mo, neg-strain, pumping blood in two different directions simultaneously, increased cardiac stress, risk for heart, attack angina, arrhythmia pangatlo, ang digestive process mo, incomplete, kasi walang sufficient blood supply, resulting in nausea, vomiting, stomach cramps, indigestion, at pat sudden deaths during exercise, madami documented cases, especially post-meal intense workouts, at hindi ito basta theory. Ito ay backed by sports medicine research, cardiology, studies, gastroenterology journals, layout nagogri, exercising immediately after eating, lalo na heavy meals, dangerous kaya sa video, na ito, i.e. explain ko sa inyo, backed by science. Kanganoa, exactly, ang nangyayari sa katawan. Mopag, nag-exercise ka. After eating bakit, delikado sa heart, say digestion, ano ang safe timing, at paano mag-exercise safely without health risks. Kaya tanong kayo sa inyo, nag-exercise ba kayo immediately after meals, o naghintay kayo na helang oras ay kumanino, ang practice nino. Intindihin natin ang blood flow distribution sa body. Ang circulatory system mo may limited blood volume, around 5 to 6 liters lang for average adult, at ang heart mo nagpump ng blood to different organs depende sa priority at need, normal resting state, balanced distribution, pero pag may specific activity, nag-redirect ang blood flow to organs, nakalangan, at dalawang major processes ang nag-require ng significant blood flow. Digestion at exercise, pero ang problem, ang dalawang processes, nito, hindi compatible simultaneously. Ito ang pag kumain ka ang digestive system mo nag-activate stomach, small intestine, pancreas, liver, liad, nagwork, at ang process na ito requires massive blood flow, kasi ang digestion nagnegi ang oxygen, oxygen nutrients, enzymes liads delivered through blood, so after eating ang body mo, automatic nag-redirect ng blood flow to gastrointestinal tract, splanchnic circulation, up to 25 to 30% ng cardiac output, pumupunta sa digestive organs, ang normal, pero pag nag-exercise ang muscles mo, din ng massive blood flow, cause exercise, aerobic or anaerobic, needs oxygen delivery, nutrient supply, waste removal, lahat through blood, so during exercise ang body mo dapat mag-redirect ng blood flow to skeletal muscles, up to 70 to 80% ng cardiac output during intense exercise. Pero ang tanong, pagkakain mo yulang, tapos mag-exercise ka, nasaan pupunta ang blood, digestive system ba o muscles, at ang sagat, divided, insufficient for both. Ang result, incomplete digestion, cause kulong, ang blood supply, sa stomach, at intestines, kaya nag-stop ang gastric motility, nag-stagnate ang food, nausea, vomiting, cramps, at the same time, insufficient oxygen delivery to muscles, kasi may portion pa ang grim blood na nakalokit sa digestion, kaya premature fatigue, poor performance, increased injury risk, worst case, organ ischemia, temporary oxygen deprivation, pangaloba ang heart strain, antinhin natin, ang workload, ang heart. Normally ang heart mo, pumping at resting heart rate, 60 to 100 beats per minute, comfortable, sustainable, pero pag may demand, nag-increase ang heart rate, cardiac output, blood pressure, lahat, to meet the body's needs, at ang heart, designed for variable workload pero may limits, at isa sa most dangerous scenarios, simultaneous demands from digestion and exercise, kasi pot kumain kat lalo na heavy meal, high fat, high protein, ang digestive process, requires sustained blood flow to gastrointestinal organs, increased cardiac output by 10 to 20%, maintained for 2 to 3 hours, Yanang normal post-meal response, pero pag nag-exercise Q on top of that, especially intense exercise, jogging, running, weightlifting, HIIT, ang muscles MO, demanding 70 to 80% cardiac output, so angat mo pressure to deliver both. Digestive organs needs consistent 20 to 30%. Muscles demanding 70 to 80%. Total demand exceeds 100%. Impossible kaya ang heart, monag strain pumping harder, faster, higher blood pressure, irregular, rhythm possible, at ang consequences, multiple increased risk for myocardial infarction, heart attack, lalo na asa may underlying coronary artery disease, kahit mild blockage, pognag strain, ang heart, angina, chest pain, possible heart attack, pangaloa arrhythmias, irregular heartbeats, ang heart, electrically unstable pog, overstress ventricular fibrillation, sudden cardiac arrest. Documented cases, maraming athletes, nagalapse during post-meal workout, pangalo hypertensive crisis, sudden spike ng blood pressure, dangerous for brain, kidneys, blood vessels, at pangapat, chronic heart remodeling, pak polytulit, ang habit, ang heart muscle, nag thicken abnormally, left ventricular hypertrophy, future heart failure risk, pangat low, ang digestive problems, intindahan natin ang normal digestive process, pag kumain ka ang food, pumapasok sa stomach, nag mix with gastric acid, digestive enzymes, mechanical churning through peristalsis, muscular, contractions, tapos, processed food, chyme, slowly released to small intestine, dune continued digestion, nutrient absorption, entire process, 2 to 4 hours for complete stomach emptying, depending on meal size and composition, at ang entire process, heavily blood-dependent ang stomach muscles, needs oxygen to contract, ang enzyme-producing cells, needs nutrients, ang intestinal absorption, requires blood flow for nutrient, transport layout connected sa adequate splanchnic circulation. Paropak nag-exercise ka after eating, ang blood flow diverted to muscles, kaya ang digestive process, compromised, multiple effects, una gastroparesis, delayed gastric emptying, ang food, nag stay longer sa stomach, hindi no push to intestines, kasi walang sufficient blood for muscular contractions, feeling of fullness, bloating, discomfort, nausea and vomiting, kasi ang stomach, distended with undigested food, nag, ng nausea reflex, lalo napog vertical position during exercise, jogging, running, ang stomach content, bouncing, irritating, triggering vomit, pangalo stomach cramps, side stitches, sharp pain, sa abdomen, caused by diaphragm spasm, organ congestion, reduced oxygen supply, pangapat indigestion and acid reflux, kasi ang delayed, gastric emptying, prolonged acid exposure, GERD heartburn, uncomfortable, at panlima, malabsorption, kasi ang incomplete digestion, hindi fully broken down ang nutrients, hindi mo absorb properly sa intestines, nutritional deficiency, possible POG, chronic habit, pangapodang, documented medical cases, hindi ito theoretical long maraming real cases ng sudden death.